Hi, good morning. I'm Dr. Bhooshan Zade, Chief Consultant and Director, Department of Radiation Oncology, Ruby Hall Clinic, Pune. So today we'll talk about general information, pelvic radiation. So radiotherapy is very important in the treatment of pelvic malignancies. And what are common pelvic malignancies in India? In females, most common pelvic cancer is cancer cervix. Then it comes to cancer uterus. In males, urinary bladder, then the CA penis. These are the pelvic cancers which need radiation therapy commonly. So, most commonly, as we know, cervical cancer in India in rural females is very common, and there are important structures in the pelvic area. Apart from the disease, there is important structure like urinary bladder, rectum, small intestine, even some part of large intestine. And when we give radiation, we have to be very conformal about the radiation volume so that the adjacent normal structures would get less dose and the side effects are less. So this is little technical part, but today we are going to discuss about the clinical part of it. So what kind of a side effect a patient would typically experience during her course or his course of radiation therapy treatment, and what are the kind of precautions they can take so that the side effects are less and the journey is smooth. So typically 5 to 6 weeks of radiation to the pelvis. First 2 weeks of radiation, generally patient don't feel any side effects. Typically third week, start of third week, they may experience little nauseatic kind of a sensation or colicky abdominal pain or kind of a loose motion, or not even loose motion, increased frequency of motion, which in the next week's time they may experience loose motions or watery stools. So typically this happens because of radiation dose going to small bowel. So because of that small bowel irritation, they tend to hypermotilate, and because of that there is a colic abdominal pain or nausea sensation, and they secrete fluid in the lumen of bowel, and because of that there is a loose motion or kind of watery stools. So simple precautions what we can take to avoid this: we can always have a lot of water intake, we can always have electrolyte powder along with the water so that the minerals are replaced in our body, we don't get dehydrated, we don't get less on minerals. And some of dietary restrictions or modification we avoid on spicy and chili food, we take high fiber diets. Then some kind of irritants in the food which may trigger this kind of a problem should be avoided. And when we can always add some anti-motility and anti-secretory drugs so that these symptoms not relieved by diet modification can be relieved by some medication. Then if there is little vomiting or nausea kind of a sensation, we can always give some anti-emetic drugs which really helps in during this treatment of radiation. So, and very important, patient should walk, do some exercise, active exercise like walking. So during walking, what happens, the bowel moves, and bowel, if the bowel motility is good naturally while walking or jogging, the side effect of radiation because of bowel irritation becomes less. So routine exercise, dietary modifications, lot of fluid intake, electrolyte powder or ORS solution so that the mineral and hydration is maintained. Small little things like this, if properly done, we can always reduce the side effect of pelvic radiation patient. And of course, technology wise, when we plan radiation, we should be very careful about the volume of radiation. We should avoid unnecessarily radiation going to other parts of body by keeping it very conformal, using high ends of machineries or say softwares. What we typically call VMAT or rapid arc is the technology of radiation, was what we typically use for pelvic cancer radiation. Again, this is a very general information. In particular, patient may experience some different set of side effects depending upon some clinical profile or patient sensitivity. We can always manage that differently, but that can be discussed on clinic or with the records only. This is general information. I hope you liked it, and you can always reach out to us on our email, phone number or clinic. Thank you so much.